A very good morning to one and all present here. This is Dr. Anupama Tadepalli, Professor from Department of Periodontics, SRM Dental College, Ramapuram, Chennai. I'm here today to explain about platelet concentrates for socket augmentation. Platelets are the second most abundant cells in the blood, as we all know, and they have a lot of granules which facilitate hemostasis and also facilitate wound healing. Particularly the alpha granules which are present in the platelets, they actually have various growth factors, and on activation these platelets, they release these growth factors into the surrounding environment, and these growth factors such as platelet derived growth factors, vascular endothelial growth factors, fibroblast derived growth factors, transforming growth factors, all they facilitate enhanced wound healing by angiogenesis and facilitating mesenchymal cell recruitment, for promoting their differentiation and multiplication. So with these benefits, various platelet concentrates have been introduced into the dentistry. The basic principle is these platelet concentrates, they are having more number of platelets compared to regular blood. If you take 1 cc of blood, you will be having 1.5 to 4 lakhs platelets per cc. Whereas these platelet concentrates are the biological products which are prepared from patient's own blood most commonly, and they have supraphysiological concentration. That means if you have 1 cc 1.5 to 4 lakhs in a normal peripheral blood, these preparations have hundreds times more platelet content compared to your peripheral blood. And with these increase in number of platelets, these concentrates, they facilitate enhanced wound healing, as we discussed by various growth factors previously. And how do we extract these platelets with a greater number in this platelet concentrate is most commonly by centrifugation methods. So this centrifugation process, where we take the peripheral blood and when we spin it based on the cell density, the blood cells, they will get segregated based on the molecular weight. The RBC will be settled down at the base because they are heaviest. Then the next most abundant and dense cells are platelets. Then they will be settling down in the buffy coat area. Then we have the WBC. Then we have plasma and serum on the top. So from this centrifugation process, we can segregate the blood elements, cellular elements, and from these cellular elements, we can take most components of the platelets from this buffy coat region. From that, we can use those platelet concentrates into various clinical application. So we have understood the benefits of the platelets. So for the past 80 years, there have been numerous improvements in the platelet concentrates. So starting from the Krinsley preparation platelet-rich plasma till date, albuminated PRF. Initially, we wanted platelets. Now we want more number of intact platelets for enhanced and sustained growth factor release. And not only that, this concentrate should have, all the concentrate should have uniform growth factor concentration. So we have come now to the generation of where we have albuminated and extended platelet concentrates. So coming to the application, as I mentioned, like these platelet concentrates have been used in dentistry for various applications. Today, we are going to see a scenario of socket preservation, how we can apply this platelet concentrate for enhanced wound healing. We all know once we remove the tooth, the alar bone starts resorbing, and if you don't preserve this alar bone, in future for restoration of either by fixed removal or implant supported process, we will not have enough alar ridge, which may complicate the prosthetic process. So these platelet concentrates, they can be used for socket preservation. Once we extract the tooth, we want to preserve the socket walls. So for preservation, platelet concentrates have been used in various formulations. They can be used as a clot, they can be used as a membrane, they can be used as sticky bone, or they can be used as biofunctionalizing collagen matrices that can be placed into the socket. So the process involves, today we are going to see a clinical scenario where we use socket preservation using sticky bone and PRF membrane for covering the socket entrance. So the procedure will be similar. You can see, like, we will take the blood from the antecubital fossa, peripheral blood. We will collect around 10 cc of the blood. We will take either directly into the vacutainer, or you take from the syringe and then you transfer to the vacutainer. So in this video, we are going to show you first IPRF preparation, for which we use yellow capped tubes, where the blood will be transferred immediately after procuring, and we are going to place them in centrifuge. Whenever you are placing the blood for centrifugation, equal volume of the saline we need to put for counterbalance in the centrifuge, and we will spin for the recommended setting. Usually the centrifuge comes with the presets. Otherwise, for 700 rpm for 3 minutes, you can spin for injectable or liquid form of platelet concentrate preparation. So once you spin the blood, you can see the RBC are settling down at the bottom, and you have a center buffy coat, and the top you have WBC zone. From this, you can take the liquid platelet concentrates with a syringe. You can take from the buffy coat region, you take the liquid portion which has the highest number of platelets. So you can include a little bit topmost zone of RBC, since we are using a angulated centrifuge. So once you take this injectable PRF, you can keep it aside, and you will be using any of this commercially available, or you can even prepare your own dentin mineral matrix. So you can mix this bone graft with your liquid growth factors, which is nothing but IPRF in this video. So if you see, these bone graft particles, they are not cohesive at the initial when you mix with the platelet concentrate, but after 10 to 15 minutes, you can see there is a cohesive mass which is pliable and which can be easily adaptable to any defect scenario. So here we are using a socket scenario. So you can see how the particles are made compact, convenient for facilitating application, therapeutic application. So you can see this sticky bone, which is nothing but mineralized plasmatic matrix, the bone grafts combined with your growth factors. This can be kept in the prepared socket. Make sure that the tooth has to be extracted atraumatically, preserving the socket walls, and there should not be any granulation tissue or soft tissue inside the socket. You need to debride it. Then you apply this sticky bone till alveolar bone margin. So till bone margin only you are going to put the sticky bone. After this, the remaining soft tissue entrance, which is a socket entrance, we can either close with a PRF membrane or collagen matrix, which is biofunctionalized. Here we are showing a APRF membrane, where we have taken again 10 cc of the blood, and we have spin for 1800 rpm for around 13 minutes. Then we are taking this PRF membrane, and we are separating the PRF clot from the test tube, and we are gently compressing with a wide periosteal elevator. You can also use a PRF box, which can facilitate you to get uniform PRF membrane. Once you get this PRF membrane, you can keep it in the socket entrance. You can transfer to the socket entrance and gently you place it. If you have got a larger membrane, you can even place multi-layered PRF membrane. You can fold it and you can put it in multiple layer. Okay. So this is how we can place the PRF membrane at to close the socket entrance. After this, you stabilize and secure this material into the socket by placing a cross mattress suture. So you can place either external or internal cross mattress suture. So you'll be taking from the proximal papillae of the socket, and while suturing, stabilize the PRF membrane or collagen matrix, whatever you have used to cover the entrance of the socket. You may even use a small round circular FGG to cover the socket entrance. So this is how we do cross mattress suture, internal cross mattress suture. So once you finish the cross mattress suture, you can place the knot, and this process, by placing this PRF material in form of sticky bone and PRF membrane, it facilitates socket healing by enhancing the speed of wound healing. But not only that, you also get good quality of bone formation within the socket. So it preserves socket walls, and also it facilitates enhanced healing and better quality of tissue forming in the socket area.